Welcome. I was a caregiver like you at a time when there were no supports, such as Caregiver Space or other community options. I was what became known as the sandwich generation, so I'm interested in helping others in managing their roles as caregiver. My name is Wendy Marcus, MS, MSW, LCSW, licensed clinical social worker with 26 years of experience working with patients and families. I'm familiar with feelings of anxiety, anger, frustration, and depression in being a caregiver, as many of you are feeling now. In coping with this, both personally and professionally, I've learned to approach the task of caregiving in ways that may be of help to you. Each of you is unique, as are those you care for. How one reacts to the role of caregiver is a combination of personality, the relationship's strengths and weaknesses, and your attitude. I believe it is not what the condition does to your loved one or to you, but what you bring to the condition. Your attitude about it is what colors your responses to many areas of your life. There is no right way to give care. We each have a comfort zone. Caregiving awakens in us feelings about our own vulnerability as well. Sometimes we may feel like the child we once were, seeking approval and love from the ones we are caring for now. I wish to address today the problems of discussing with your loved one a change in their care. For example, if you have to explain the reason they can't drive anymore, or the need to go to a nursing home, or other issue, many of you feel dread about the conversation. There are many reasons for this. We're already beginning to feel anxiety, fear of rejection, depression, and anger, and we do not want to inadvertently make the person feel worse or be the cause of their decline. For a loved one who is cognitively intact and can communicate, starting the conversation can open a floodgate of feelings from the patient, much like your own, or not. Possibly patients have been dealing with their health decline, fears for the future, and possible death, all the while protecting you. Here are 7 strategies that may work for you. Number 1, you need to take care of yourself, your mind and your body, to be able to care for others. Keep your appointments with your own MD. Remind yourself that when flying, the airline attendant talks of putting the oxygen mask on yourself before helping others. So you need your oxygen mask every day. In my experience, a spouse taking care of a loved one who is not taking care of him or herself may regret it. The caregiver's health declines and can no longer care for the patient. I've seen this happen time and again. Number 2, use resources. Ask for help from your primary care physician, see a therapist or clergy, attend a support group with a friend. Ask family for support, even if they only listen. Number 3, remind yourself your loved one is struggling with similar feelings and may want space from you. They're used to independence. Unless they live with you 24/7, they're not used to you being around as often. They need their space. That's key. Respect their privacy. Number 4, saying the words "for now." When a loved one requires a change of some kind, it is more comforting saying the words "for now" because it leaves room for other options. Saying the doctor thinks it's best for you to go to a nursing home takes the onus off of you. Also, if you're unsure what to do, ask the doctor if he or she had a mother or sister like your loved one, how would they handle it? You would be surprised what they may come back with for you to say to her. Also, if you have written permission through the paperwork from your doctor's office that you may speak on behalf of your loved one, you have a healthcare proxy or your power of attorney, the doctor will speak with you and can take your calls, even if it's a consultation. So don't hesitate to be able to use your primary, especially the primary care doctor, in helping you addressing the concerns you have about stating this change of care, so the doctor can be helpful to you. Number 5, write your thoughts on a personal private journal. It is a therapeutic technique to face feelings this way. We often use this in therapy, and it helps because we can write our feelings down and look at it 24 hours later and see if we still feel the same way. Maybe we don't, maybe we do, maybe we want to expand upon it a little bit more. It's a very helpful, what we call therapeutic tool, to get out all those feelings of anger and frustration and anxiety. Number 6, remind yourself you are stronger than you realize. You didn't ask for this role as caregiver. You were thrust into it. You've risen to the challenge, and you will continue to be okay. Number 7, change will come, and you need to remain flexible. Remember, too, that the only thing constant is change. Once again, my name is Wendy Marcus with the Caregiver Space. Thank you for watching.